A Dauphin County woman had an appointment to get her nails done just in time for New Year's Eve. It's an appointment Katie Jackson will never forget. Here's her journey. Every 2 weeks, this is where you'll find 30-year-old Katie Jackson.
Hi, Ann.
Hello, Katie. How are you?
Good. How are you?
Good. What's going on?
This past December 30th, Katie had a nail appointment.
I made a 10 o'clock appointment because I had brunch with friends of mine later on. So I was like, I want to get my nails done before I go for brunch. So I came in just like regular day, like ready to go. I had my coffee with me.
We've been talking about the kid education in different country, and I told her about the country, my country I'm from.
I started to get like a slight headache, and I'm prone to migraines. So I thought, I'm gonna get one. And I had my coffee with me, and I went to take a drink of it. I thought the cap was loose. I didn't realize I spilled it.
And she get the cup and drink, and I saw the coffee spill out from her mouth.
I had like blotches on the side of my peripheral vision got real blotchy. And then I saw Ann start to clean up where I spilled, and she said to me, Katie, are you okay? And I wanted to respond to her, but nothing came out.
And I realized something wrong, but I didn't say anything. I told my co-worker.
Ann came out and asked me to come out because there was a client she was worried about. And I guess she came and got me simply because I work in healthcare fields and I deal with a lot of elderly people.
A nail technician called 911. In the meantime, Katie's boyfriend Anthony and Aunt Beth showed up.
I came in, and right away I could see she was crying. Nothing jumped out at me right away as to what could be wrong.
I had no idea what was going on. I was like, what could be wrong with me that I can't talk to anybody or I can't even move?
Everyone tried to keep Katie alert before EMS arrived.
All of a sudden, I asked her to smile because I know that's a telltale sign for a stroke. And one side of her face started to droop and the other side went up slightly, and I recognized it like that, like, okay, she's having a stroke.
Anthony realized Katie was having a stroke too when he watched her try to get onto the stretcher.
When she stood up and basically buckled, trying to get on the stretcher. From there, my heart sank.
As soon as I got up, I just dropped. Like I couldn't move my legs. Like there was no coordination going through my body.
They loaded her in the ambulance, went to Hershey Med. I got a ride there with my aunt.
EMS crews called Hershey Medical Center's emergency room to give them a heads up for a possible stroke patient.
They noticed her deficits, and that's why they called the command, and the physician is in agreement with them, and they activate, like I said, what we call a brain attack here, and that's where we can start getting our steps taken to be proactive as soon as she arrives. So we were able to get our pharmacy, our other nurses, our techs, our emergency medicine doctors, our neurology team at bedside as soon as that patient arrived. From that point, neurology consulted all the necessary physicians needed to take the next steps.
I saw lots of doctors come in, talking to me, saying like, this is what we're planning on doing. And Anthony was there at my bedside the whole time, so they talked to him about exactly what they were going to do.
I was messed. I was crying. I didn't know what to do. The only thing I could think of, just be there for her, and stay strong, and reassure her that everything was going to be okay.
And joining us is Katie and Anthony Jackson, and Katie's neurosurgeon, Dr. Kevin Cockcroft, the co-director of the Penn State Health Stroke Center. Thanks for being here. Dr. Cockcroft, why don't you take us through this? Katie arrives in the ER. What's the next step?
Sure. Well, the first step we want to do is try and evaluate her to see if she's eligible for the clot-busting drug, or TPA. When we do that, the most important test for that is a CAT scan, and we actually want to see that the CAT scan is negative. We don't want to see a stroke on it yet, and we don't want to see any bleeding. And if that's the case and she's here early enough, then we can give her the clot-busting drug.
And you were able to?
Yes.
Katie, you could hear everything that was going on around you, but you could not talk. What were you thinking?
I had no idea. The doctors were coming in, the nurses were coming in, they were checking my vitals, taking me for tests, and it was like a big question. I had no idea what was happening to me.
Anthony, you were right there by her side. How were you holding up?
It was tough. I didn't know what to do. Like I said, just be there for her, reassure. I was lost as well.
Dr. Cockcroft, you gave her the TPA, but then there was another procedure you could do. Talk to us about that.
Yes, well, it turned out that it looked like Katie was going to have a very large stroke. And we know that the drug itself is not good enough when you're having a large stroke. We can actually do more than that. And we can do a procedure where we go inside the blood vessel and pull out the clot. And I actually have a device with me today. This is called a stent retriever. And it's a device that actually goes in and grabs a hold of the clot and pulls it out. And that's what we were able to do on Katie.
And Katie, you had told me earlier that you could feel the effects from this device immediately.
Yeah, it felt like they blew up a balloon and then like pushed the air out. And then all of a sudden I was able to answer their questions. I shook someone's hand, so I was able to move my body and like talk.
Wow, incredible. And Anthony, when you heard this, what was your reaction?
Relieved. Weight been lifted off my shoulder. I got to see her and all was well.
And we've heard that clots can happen, strokes can happen at any age. Katie is young. Dr. Cockcroft, any idea what caused this stroke?
Yes, it turned out it was probably a combination of things. Katie was on a birth control pill, and that can make some people's blood clot more easily. And then on top of that, she had what people would refer to as a hole in the heart. We call that patent foramen ovale, or PFO. And the clotting in her blood then transferred these clots across the heart and went up into the brain, causing a brain blood vessel to become blocked, and that was the stroke.
What restrictions does she have now?
Well, she doesn't have too many restrictions, but probably the most important ones are to take a medicine to thin her blood, and then she's going to later have some surgery to repair the hole in the heart.
And what type of side effects have you felt? You weren't even aware of this hole in the heart.
I wasn't. So now it's just basically my brain, my memory is, I can't remember a lot of things, and word recall. Sometimes my sentences don't make perfect sense. And then looking at how to repair the hole.
And Katie and Anthony, you have been dating for 6 years. This event changed everything very quickly. Talk to us about that.
Well, before the stroke happened, I actually had ordered a ring for Katie. I was planning on proposing to her. Unfortunately, this happened. And I decided not to wait any longer. And 2 days after we got out of the hospital, we got married.
Yeah, he proposed to me inside the hospital, and I said sure. I didn't really think we were going to do it 2 days after.
And Katie, your recovery was very quick. More than a month after this happened, you returned to work.
I did. I just wanted to feel normal again. I just wanted to get back to work, start working out again. I wanted to be how I was before the stroke. Because afterwards I was exhausted. It took a lot out of me just to walk to my mailbox to get my mail. So your body really changes from it.
Katie and Anthony, thank you so much for sharing this story. Such an inspiration, really, to everyone who is watching.